This was an amazing campaign to be part of. And my job is to tell the public health side of the story, and then Vinny will tell the organizing side. So just to begin with, excessive alcohol use is a significant public health problem. And raising alcohol taxes is one of the most effective strategies for reducing and preventing excessive alcohol use. The research base is very, very strong, but few states succeed in passing alcohol tax increases. And the Maryland campaign was the model for what a successful campaign, in my view, should be like, a real partnership between public health and political organizing. Excessive alcohol use is the third leading lifestyle-related cause of death in the U.S. after smoking and diet and physical activity, responsible for about 79,000 deaths a year. It's the leading drug problem among young people. And in the state of Maryland, it's responsible for 1 out of 3 deaths of persons between the ages of 15 and 20. The effective strategies for reducing and preventing alcohol use, and this isn't opinion, this is from a very large global review of the research literature. What we try to do is to reduce overall alcohol consumption, and one of the most effective ways to do that is to increase taxes. We try to reduce heavy drinking, and increasing taxes is an effective way to do that. We try to prevent and delay the onset of use, and increasing taxes is an effective way to do that. Why are taxes so important? Well, in this respect, alcohol is an ordinary commodity in that the law of demand applies. The law of demand, one of the basic laws of classical economics, is that the quantity demanded of a price will rise in inverse relationship to its price. So when the taxes go up, the price will tend to go up, and when the price goes up, people drink less. And this includes heavy drinkers, and it includes young people. And when people drink less, there are fewer alcohol problems. In fact, the evidence suggests that the evidence is substantial, and the reason that it works this way is because alcohol demand is what economists call elastic, so that alcohol is not a necessity product. When the prices go up, people will actually consume less of it. According to one analysis, a 10% increase in the price of alcohol in the U.S. would lead to about a 7% drop in beer consumption, about a 5% drop in wine consumption, and close to a 15% drop in distilled spirits consumption. The biggest downside to raising taxes is issues about control of the market, like smuggling, cross-border purchases, and things like that. So taxes will only work if these are not a significant factor. The reasons for raising alcohol taxes, the public health research literature, there are 2 things that we do around alcohol where the literature is largest and most robust, and one is around minimum drinking age of 21, and the other is taxes. But not just for the public health research reasons. The politics of alcohol taxes, opinion polling finds over and over again that the public supports alcohol tax increases, especially if they're earmarked for good things, as in this case, developmental funding for people with developmental disabilities, mental health services, alcohol and other drug services, and so on. But there are some other reasons, and let me walk through them quickly. One is the economic principle of fairness, that if prices are too low in an economic sense, that is, they don't cover the cost of production and consumption, then people will drink too much economically, in that the utility provided to the drinker of some of those drinks, particularly those at the margin, is less than the costs of production and consumption, including the cost to society. Now, the latest study from the Centers for Disease Control about the costs of alcohol to society estimate that alcohol costs us about $1.90 for every drink consumed. And taxes don't come anywhere near recovering that cost. So low alcohol prices are bad economics. They're also inefficient. The alcohol taxes can correct for some of the negative externalities of alcohol use, which are the bad things that happen to other people because of the drinkers drinking. And they can also correct for some of the inefficiencies of the alcohol market. Alcohol producers are an oligopoly, particularly beer. 2 companies are responsible for approximately 80% of all the beer sold in the U.S. And this enables them to charge artificially high prices. And in fact, every year, there's a ritual in the fall where Anheuser-Busch announces a 3 to 4% price increase, and the rest of the industry follows. And then there are the revenue needs. And the fact of the matter is that alcohol taxes used to pay for a whole lot more of government and public services that they do now. This tracks things just since 1977, but you can see the two, the turquoise and the green curves here are the decline in total revenues in constant dollars over time. And then this light blue line down at the bottom is, I'm sorry, the green line and the light blue line are the decline in federal and state revenues, respectively, and the turquoise line is the decline in the percent of total federal tax revenues made up by alcohol. And it starts from a fairly low level, about 1.5%, but goes down to an infinitesimal level of about 0.4%. So there are revenue needs. And part of why this is an issue is because most alcohol taxes are flat taxes. They're based on the volume of the beverage. And so the volume of the beverage doesn't change, but inflation goes up every year. In essence, this industry gets a tax cut every year because the tax rate does not keep up with inflation. Here you can see these are nominal tax rates converted to cents per ounce in consistent 2005 dollars. And you can see there's a little bump right here in 1991. This is when the federal tax on alcohol went up, but the effects of that tax have mostly decayed since that time. Many states try to raise their alcohol taxes every year, and this is just a graph, and you can see something striking about the graph, which is that it's much easier to do this in odd-numbered years than even-numbered years, and that's, of course, because the even-numbered years are election years. But if we drill into this a little bit, you can see that in 2009, 40 states considered an increase, 8 of them passed one. 23 states considered one in 2010, 0 passed. Why don't they succeed? Well, this Maryland case study is a study in what you have to do in order to succeed. They don't succeed because there's a lack of organizing, because there's not a sufficient constituency behind it. There's a lack of relevant public health data and spokespeople, and there's tremendous opposition. The alcohol industry knows that increased taxes mean increased prices, mean lower sales of alcohol, and consistent industry political donations and lobbying are aimed at keeping alcohol taxes from increasing. My first experience with trying to raise state alcohol taxes was years ago in California. In 1989, the state passed a tobacco tax that funded all sorts of wonderful things like California's very effective tobacco counter-advertising campaign. So we tried a similar thing on alcohol in 1991. The same very similar coalition behind it, the same legislators behind it, et cetera. The alcohol industry spent $40 million to defeat it. It even put its own initiative on the ballot, because this was by ballot initiative, calling for penny a drink. We were calling for nickel a drink. It was to confuse the voters. It was a recession year, and all the revenue-raising measures lost. The only win we got is next year the legislature raised the tax on alcohol by a penny a drink because the industry had shown it was willing to live with that. Other recent experiences, Massachusetts included alcohol for the first time in their state sales tax in July of 2009. This is a classic case of having an insufficient coalition behind your tax increase. The tax was repealed at the ballot in November 2010. Illinois, the governor needed money to fund infrastructure improvements, no coalitions, no public health voice to speak of, but substantial increases in the tax because he had the political will in the legislature to do that. And then Maryland, what we're talking about here, which we'll go into more detail. What did we do in Maryland to build the public health case? We simply tried to collect everything that we had on the mortality, morbidity, and costs of alcohol use in the state. We looked at the public health research on effective responses and summarized the research. We modeled the public health impact of an excise tax, of a tax increase, and we did research that was designed to counter the likely alcohol industry arguments. So what did we find? For instance, As I said at the beginning, it's the leading drug problem among youth, causes 1,278 deaths and 70,470 violent crimes in Maryland every year. About 343,000 Marylanders meet the criteria for alcohol abuse or alcohol dependence. So we looked at costs. I mentioned the CDC cost study. This is the most recent one. It's about $746 per adult in the U.S., total of $223 billion, slightly higher than the cost of tobacco. Much of this due to lost productivity, and 3/4 of it coming not from alcoholics, which are the people who get much of the focus for alcohol services, but actually from binge drinking episodes, from people who are otherwise moderate or quote-unquote social drinkers, but who drink too much. There are a lot of those people. They drink too much a lot. They cause a lot of problems. All right, so the evidence suggests, and I've said this before, but this comes from systematic reviews of the literature. The top one done for the World Health Organization by a group of 15 researchers from around the world. CDC's Community Guide to Preventive Services does systematic reviews of the literature. Philip Cook's an economist at Duke University. He's actually published a book on this, done a number of studies. And then the science arm of Congress, the National Research Council and the Institute of Medicine, also looked at this in 2004. In the World Health Organization's global strategy on alcohol, pricing policies, including tax, are one of the 10 key areas. So what's the evidence? The most recent meta-analysis looked at 110 studies containing more than 1,000 estimates of the relationship between tax and price of alcohol and alcohol consumption. And I quote, "A large literature establishes that beverage alcohol prices and taxes are related inversely to drinking. Effects are large compared to other prevention policies and programs. Public policies that raise prices of alcohol are an effective means to reduce drinking." The Centers for Disease Control concludes similarly, we recommend increasing the unit price of alcohol by raising taxes based on strong evidence of effectiveness for reducing excessive alcohol consumption and related harms. Public health effects are expected to be proportional to the size of the tax increase. So this just illustrates the issue with alcohol taxes being flat taxes. This shows you where the taxes would be if they'd been adjusted for inflation at the federal level since they were first set in 1951 when it was $9 a barrel. In 1991, the beer tax was raised to $18 a barrel, but adjusted for inflation, it ought to be $76 a barrel, substantially higher than where it is now. The case is similar for spirits and wine. The public health goals around alcohol taxes, it makes sense to tax based on the level of the high-risk agent in the product. And so this is where we get to, we'd like taxes to be equalized based on alcohol content. We'd like them indexed to inflation, so they go up every year with inflation. And we're also increasingly in favor of setting minimum prices. This is to avoid things like what's happened in the UK in the last decade, where a torrent of cheap supermarket booze has transformed their drinking culture and led to very substantial problems, particularly among young women in their 20s. So if we did this in Maryland, and this is an analysis that the Speaker's office actually asked us to do at one point during the alcohol debate, if we adjusted the Maryland taxes for inflation, they'd be 47 cents per gallon. And if we equalize them to spirits, they'd be $1.53 a gallon as opposed to 9 cents a gallon, which is what they are now. Similarly, the spirits tax, currently $1.50 a gallon, and if it were adjusted for inflation, $12.20 a gallon. All right, I've talked about elasticity, but the beauty of the elasticity issue for alcohol is that alcohol taxes are a win-win for governments. Governments can increase the tax and price and then get more revenue, and at the same time depress alcohol consumption and reduce alcohol problems. And the problems that are reduced, and these are specific studies that have been done on these outcomes showing that changes in alcohol tax and price will influence the prevalence of these health problems in the population: liver cirrhosis, DTs, male suicide, criminality, hospitalizations. alcohol-related disease mortality overall, workplace injuries, sexually transmitted diseases, interpersonal violence, rapes, robberies, severe violence towards children. And interestingly, if you raise an alcohol tax, there's no apparent impact on possible health benefits of regular, very light alcohol consumption among moderate drinkers. So in Maryland, we did a bunch of modeling. The first thing we had to do was to model how big the tax would be, how much money it would raise. We estimated we had initially modeled a dime a drink. That was the initial request of the coalition. We estimated it would raise the prices by about 6.5% across the board and lead to about a 4.25% decrease in consumption, and would generate about $215 million in new revenues. And then we went health problem by health problem, and where we could get data and there were credible studies that we could use for our modeling, we actually modeled that it would save 33 lives a year, that it would prevent, for instance, 13,000 cases of alcohol dependence or abuse every year in the state. We also worked to respond to some of the industry's arguments. The industry argued that the tax increase would be bad for the economy, would cost the state jobs, that it was regressive, hitting poor people the hardest, and that it would force people to cross borders to buy their alcohol and thus be a money loser for the state and its businesses. So taking those one by one, is it bad for the economy and the jobs? Well, the initial proposal will raise $215 million, and that money doesn't just disappear. According to the original proposal, it would have been spent in the relatively labor-intensive fields of healthcare, developmental disabilities, and alcohol and other drug prevention and treatment service delivery, as opposed to where it's currently spent, which is the employment comes in the alcohol industry, which is highly capital-intensive. We also estimated it would save the state of Maryland at least $225 million in healthcare costs, criminal justice costs, property losses, and so on, including substantial productivity gains, an estimated $132 million for more attentive and fewer absent workers. Our alcohol tax is regressive. This is a really interesting thing about alcohol. It is a luxury product, and although if you drink, you're more likely to drink more as a drinker, the fact of the matter is that fewer poor people drink than rich people. And if you look at binge drinking, which is the risk behavior that's responsible for 3/4 of alcohol problems, what you find is that binge drinking is actually most common among people who make $75,000 a year or more. Which is powerful evidence. Harmful use of alcohol actually rises with income. The cross-border issue, we did a systematic review of the literature, studies of this in the U.S. The studies were frankly all over the map. Some found no effect for beer, some no effect for spirits, and vice versa. But when the effect was found, the studies agreed that the effect was not large enough to significantly impact a state's ability to raise additional revenue. And only one study actually interviewed consumers after a tax increase about their cross-border shopping behavior. The increase was in Iowa. It was roughly the same size as the Maryland increase. Now, only 3% of past year and none of past month drinkers increased their cross-border shopping. We also compared the actual alcohol prices in Maryland and 5 neighboring states. We rented some grocery and liquor store scanner data and found almost no relationship between average retail price and the alcohol excise tax rates for spirits, and only a very slight relationship for beer when looking at the cheapest beer brands. Our conclusion was that alcohol is actually highly price competitive across borders, with retailers adjusting prices to meet competitive pressures and maximize profits. So we did not expect that cross-border shopping would have a significant impact on the state's ability to raise the anticipated revenue. And this is just a graphic showing the correspondence or lack thereof between beer excise taxes and average prices as they're actually charged in the 6 jurisdictions. We learned a lot from this campaign, and so we have a future research agenda that we hope will be helpful to future research campaigns. We've been funded by the Centers for Disease Control to set up a research collaborative that's going to evaluate the effects of the recent tax changes in Massachusetts and Illinois. We've also applied to the state of Maryland to evaluate the Maryland tax increase. We're also going to rent space. Economists at the University of Illinois at Chicago will rent space on one of the giant macroeconomic models and actually do some modeling to estimate the precise numbers of jobs that we can expect would be lost and created in the wake of various alcohol tax increase scenarios. We're going to do some case studies here at Hopkins about how the research gets translated, including a case study we're developing on the Maryland situation, trying to fill in, as I say, some of the gaps in the alcohol tax research. And then we've also been funded by CDC to do an action guide oriented primarily to public health departments with a secondary audience of state and local coalitions interested in this issue, looking at what it actually takes to increase alcohol taxes. There are a number of things to look at in terms of assessing readiness. Certainly it's helpful to have a well-positioned champion in both houses of the legislature, to have an understanding of the political strength of the alcohol industry and its allies. It's pretty important to have the support of the governor, to know whether earmarking designated the funds is permissible in your state. If you have a high proportion of non-drinkers in the state, chances are it may be easier to get popular support, as well as if you have a high proportion of evangelicals or fundamentalists. Support of major media, low taxes relative to surrounding states, little cross-border trade in alcohol, the number of years since the last increase, and the ratio of state government alcohol costs to the revenue that the government actually takes in from alcohol. These are all important things to look at. Some of them were true in the case of Maryland, some of them weren't. But certainly we did have budget deficits, and so many states have those at this point. But most importantly, and by way of introducing Vinny, we had an incredible group of advocates and an incredible coalition that could take the research findings and bring them to the public, to the media. It's also important to look at the availability of funds that can be used for legislative advocacy and the existence and efficacy of a lobbyist for the issue. Not every state will have Vinny DeMarco, but a lot of states can learn from what he does. So it's my real pleasure now to switch slide sets and bring Vinny up to the mic.